Bonjour tout le monde. A few days ago,
Good morning, everyone.
I got a letter from Jonathan in Ontario. He wrote to me because he's concerned that Canada is on track to end up like the UK or France, where they're facing skyrocketing cases of COVID-19. For Jonathan, he's thinking first and foremost of the lives of the people around him. Jonathan closes his letter by saying, "Whatever needs to be done. I value the economy, but I value my own friends, family, and fellow citizens' lives first." Thank you, Jonathan, for reaching out. I understand what you're saying, and I totally agree. But here's the thing. By putting the health of your friends, family, and fellow citizens first, you're actually doing the very best thing to protect the economy, too. We don't have to choose. We just have to act. On Saturday, Quebec, Ontario, Saskatchewan, and Alberta all saw record-breaking new cases. Dr. Tam has warned that this may mean hospitals soon reach a breaking point. In Nunavut, there have been outbreaks, too. As the government of Nunavut announced on Monday, a territory-wide lockdown will go into effect tomorrow morning. No one wanted to see this news, but it was a possibility we had to be ready for. Our government has provided a 3-month supply of personal protective equipment to Nunavut, just like the other territories, so communities are prepared if bad weather delays shipments. We've also provided funding through the Safe Restart Agreement, as well as additional direct support for communities through the Indigenous Community Support Fund. The federal government will continue to support the people of Nunavut, just like we will for all Canadians. That's exactly what I told the premiers when we met last week. At the same time, though, I also reminded them that resources are not infinite. Depuis mars, nous avons envoyé plus de
Since March, we
312
have sent over 312 million articles of personal protective equipment to the provinces and territories, including masks, gloves, shirts, and face coverings. We've also sent close to 12 million swabs and hundreds of ventilators. This adds to the contribution of over $25 billion that we have given to the provinces and territories to support Canadians throughout the country. Whether it's been through the Safe Restart Agreement or a fund for a safe return to school or transfers for essential workers, healthcare, and the North, we are making sure that Canadians are getting the funds that they need. We're continuing to prepare to distribute a safe and efficient vaccine throughout the country as soon as it's ready. On this topic, yesterday we received new encouraging news about a second possible vaccine, this one produced by Moderna.
Canada has already secured tens of millions of doses of the Moderna vaccine candidate, along with a wide range of other promising options. Like Pfizer-BioNTech, Moderna has already submitted their vaccine candidate for Health Canada review, an important step in assessing efficacy and safety. This is good news, but remember, a vaccine can only protect you once you've gotten the shot. So until that happens, we all need to double down to get this second wave under control. Particularly speaking to young people. This virus might seem like it's more of a concern for your grandparents than for you. But even if you're young and healthy, getting COVID-19 can be incredibly serious. It could leave you with heart and lung issues, or it could cost you your life. I don't say this to scare you. I say this because we need to be honest with ourselves about what we're facing. You need to be wearing a mask, keeping your distance, and washing your hands. You need to avoid gatherings. You need to get your flu shot. And you need to download and use the COVID Alert app. If you get a positive COVID-19 test result, the first thing you need to do is open your COVID Alert app and enter the one-time code your provincial health authority provides. This will anonymously notify people you may have been in contact with so that they can get tested too. Then go straight home and isolate. Don't stop at the grocery store. Don't stop to say hi to your neighbor in their driveway. Go home. And after you've done all that, call someone you love. A positive test result can be scary. I remember how we felt after Sophie got her results back in March. There's uncertainty and anxiety, but pulling together and following public health guidelines will get us all through this. Pour les familles, les parents et les
For
travailleurs,
families, parents, and
je sais que les
workers,
choses
I
sont
know
difficiles.
that things are
Mais on ne
difficult,
peut pas abandonner
but we
maintenant.
can't throw in the
Peu
towel
importe
now.
votre âge,
Regardless of how old
portez
you
le
are,
masque,
wear
gardez vos
a
distances
mask,
et
keep your
lavez-vous les
distance,
mains.
and wash your hands.
Évitez les rassemblements.
Avoid gatherings.
Faites-vous vacciner contre la grippe
Get the
et
flu
servez-vous de
vaccine
l'application
and
Alerte
use
COVID.
the Alert COVID
Comme on
app.
l'a fait au printemps dernier,
As we did in the
c'est
spring,
ensemble qu'on va
it is
réussir à
together
traverser
that
l'hiver.
we will succeed to get through this winter. Our government will do what it has to be there for
aussi
you
longtemps qu'il le
as
faudra.
long as is necessary.
À ce propos, je tiens à mentionner
And
que
I'd
la
also like to
nouvelle
mention
mesure de
that the
soutien que nous avons
new
annoncée pour
support
les
measure that we
entreprises
announced for
en ce qui
businesses
concerne le loyer,
for
l'aide salariale,
rent,
les prêts
salary,
et le
help,
soutien en cas de
loans,
confinement
and
a été
support in the
adopté
case of
par la
confinement
Chambre
was
des communes.
adopted by the
On
House
se
of
trouve
Commons.
maintenant devant le
It
Sénat.
is now before the
Comme l'a
Senate.
dit la vice-première ministre, on
As
espère
the
que ce projet de
Vice
loi
Prime
sera
Minister
adopté
said, we hope that this
rapidement
bill will be
afin que
adopted
les
quickly
employeurs et les
so that
employés
employers
puissent
and
obtenir le
employees
soutien
can
dont
get
ils ont
the
besoin
support they
aussitôt que
need
possible.
as soon as possible.
I want to end this morning by talking about something else our government is doing to protect you and your family. Earlier today, Minister Baines introduced the new Consumer Privacy Protection Act to give Canadians more control and greater transparency over how companies handle their personal information. This includes allowing people to move their information from one organization to another and the right to have their information deleted. For companies that don't follow the rules, the CPPA gives the Privacy Commissioner order-making power and the highest fines amongst G7 privacy laws. Aujourd'hui, le ministre Baines
Today,
a présenté le
Minister
nouveau projet de loi
Baines
sur la
presented
protection des
the
renseignements
new
personnels des
Act
consommateurs
on
pour donner
privacy
plus de
measures for
contrôle aux
individuals to give
Canadiens
more
et leur
control
offrir
to
une plus grande
Canadians and
transparence
offer them
en ce qui
greater
concerne la façon dont les
transparency
entreprises
around the
traitent
way
leurs renseignements
businesses
personnels.
use their
Il s'agit
confidential
première sur la
information.
scène
This
internationale.
is a
Ce
very
projet de
first
loi
on the
s'appuie sur
international
le
scene.
travail qu'on a déjà
This
fait pour
is founded on
protéger
the
les
work that
données
we already
et la
did to
sécurité des
protect
gens en
information
ligne,
and the
y
safety of
compris
people
avec
online,
la charte du
including
numérique
with
qu'on a lancée
the
l'année
digital
dernière.
charter that we launched last
Pour
year.
rebâtir une économie forte
To
et résiliente,
rebuild a strong and
protéger
resilient
les emplois
economy,
et soutenir
protect
les petites
jobs, and support
entreprises
small
alors qu'elles
businesses
s'adaptent à cette
because
nouvelle
they're adapting
réalité,
to this
on
new
doit s'assurer
reality.
que
And so we
l'Internet
need to
soit
make sure
accessible,
that the internet is
fiable
accessible,
et sécuritaire.
reliable, and safe.
Merci. Je cède maintenant
Thank
la
you.
parole à la
I'll
docteure
now hand it over to Dr. Tam.
Good day, everyone. Bonjour à toutes et à tous. There have been 302,192 cases of COVID-19 in Canada, including 11,027 deaths. Nationally, there are close to 51,000 active cases across the country. Over the past week, labs across Canada have tested an average of over 58,400 people daily, with a 6.6% testing positive. Yesterday, 4,802 cases were reported nationally. In addition, there were over 1,300 new cases reported for Saturday and Sunday. This brings the average daily case count to almost 4,800 cases for the past week. The number of people experiencing severe illness continues to increase. Over the past 7 days, there were on average 1,675 individuals with COVID-19 being treated in Canadian hospitals, including over 330 in critical care, and an average of 66 deaths were reported each day. Over the weekend and yesterday, there were a number of very troubling developments in the trajectory of COVID-19 resurgence in Canada. In addition to an ever-increasing case counts and rising numbers of hospitalizations, critical care admissions, and deaths, we are seeing disease transmission spill over into the most vulnerable populations. Cases have been increasing in elderly adults for several weeks, with those over 80 years of age now having the highest incidence rates nationally. More and more outbreaks are occurring in long-term care homes, congregate living settings, and hospitals, and spreading in Indigenous communities. Most recently, Nunavut had to implement a 2-week territory-wide restriction period to interrupt the spread of COVID-19. I'm deeply concerned at these developments because they put countless Canadians at risk of life-threatening illness, cause serious disruption to health services, and present significant challenges for areas not adequately equipped to manage complex medical emergencies. We have to remind every Canadian of the importance of individual actions to protect our most vulnerable. Right now, every effort you make matters. As much as you can, limit errands and outings to just the essentials, keep in-person social activities to just your existing household, and strictly and consistently follow public health measures. This is what is needed for us now to slow the spread and keep COVID-19 out of high-risk settings, keep schools and workplaces open in a safer way, and prevent further restrictions. The measure of a society is in how it protects its most vulnerable. Canadians are once again at a critical juncture. Let's do everything we can to protect and support others by staying physically apart, but using everything we've learned to support each other through these times. Keep connecting virtually, do check-ins over the phone, say hello from across the street, or drop off a care package. Whatever it takes, let's protect and support each other. I say it in the spring, and I'll say it again now. Canada, it's time to plank the curve. Thank you.
Bonjour à toutes et à tous.
Hello,
Il y a
everyone.
eu 302
There have been 302,192 cases of COVID-19 in Canada, including 11,027 deaths. Nationally, there are close to 51,000 active cases across the country. Over the past week, labs across Canada have tested an average of over 58,400 people daily, with 6.6% testing positive. Yesterday, 4,802 cases were reported nationally. In addition, there were over 1,300 new cases reported for Saturday and Sunday. This brings the average daily case count to almost 4,800 cases for the past week. The number of people experiencing severe illness continues to increase. Over the past 7 days, there were on average 1,675 individuals with COVID-19 being treated in Canadian hospitals, including over 330 in critical care, and an average of 66 deaths were reported each day. Over the weekend and yesterday, there were a number of very troubling developments in the trajectory of COVID-19 resurgence in Canada. In addition to ever-increasing case counts and rising numbers of hospitalizations, critical care admissions and deaths, we are seeing disease transmission spill over into the most vulnerable populations. Cases have been increasing in elderly adults for several weeks, with those over 80 years of age now having the highest incidence rate nationally. More and more outbreaks are occurring in long-term care homes, congregate living settings, and hospitals, and spreading in Indigenous communities. Most recently, Nunavut had to implement a 2-week territory-wide restriction period to interrupt the spread of COVID-19. We are deeply concerned at these developments because they put countless Canadians at risk of life-threatening illness, cause serious disruptions to health services, and present significant challenges for areas not adequately equipped to manage complex medical emergencies. We have to remind every Canadian of the importance of individual actions to protect our most vulnerable. Right now, every effort you make matters. As much as you can, limit errands and outings to just the essentials. Keep in-person social activities to just your existing household and strictly and consistently follow public health measures. This is what is needed of us now to slow the spread and keep COVID-19 out of high-risk settings. Keep schools and workplaces open in a safer way and prevent further restrictions. The measure of a society is in how it protects its most vulnerable. Canadians are once again at a critical juncture.
Faisons tout en notre
Let's do
pouvoir pour
everything we
protéger
can
et
to
aider les
protect
autres
and support
en
others
respectant la
by staying
distanciation
physically
physique
apart
et en mettant en
and
application
using
tout ce que
everything
nous
we've
avons
learned to
appris
support
en
each
cette
other
période
through these
difficile.
times.
Gardons le contact
Keep connecting
virtuellement.
virtually,
Appelons-nous
do
pour
check-ins
prendre
over the
des nouvelles.
phone,
Saluons-nous du
say
côté
hello from
opposé de la
across the
rue.
street,
Livrons des colis
or
de
drop
réconfort.
off a care
Faisons tout le
package.
nécessaire pour
Whatever
nous
it takes,
protéger
let's
et nous
protect
entraider.
and support each other.
Nous l'avons dit au printemps
We said it in the
et nous le
spring, and
répétons
we'll say it
encore
again
maintenant.
now.
Les Canadiens
Canada,
doivent
it's
aplatir
time
la
to
courbe.
plank the curve.
Merci.
Thank you.
Thank you, Dr. Njoo. The Prime Minister will be answering questions for 20 minutes today, starting with the phone, following with questions in the room. Le Premier ministre répondra des questions pour 20 minutes, en
The
commençant
Prime
par
Minister
le
will
téléphone,
answer questions for
suivi
20
des
minutes,
questions
starting
dans la
by
salle.
the phone line
Les
and then
docteurs
questions in
vont
the
rester
room.
disponibles aujourd'hui pour répondre à
And
vos
the
questions
doctors
par la
will
suite.
remain here to answer your
Opérateur,
questions
c'est à vous avec
after.
une question et
Operators,
sous-question.
over to you.
Thank you. Merci. First question, Janice Dixon, the Globe and Mail. Line open.
Hi, Prime Minister. The Globe reported this morning on Andrew Scheer employing his sister-in-law while his sister-in-law employs his wife. Do you believe that's appropriate?
I think that is much more appropriately a question for Mr. Scheer and for the Conservative Party of Canada.
Well, currently the House of Commons rules allow MPs to hire their in-laws. I'm wondering if you think those rules are appropriate, and if not, if they should change.
I think that's certainly a reflection that's going to be had at the Board of Internal Economy around how we ensure that we're upholding the confidence that Canadians place in all parliamentarians.
Thank you. Operator, next question on the phone.
Thank you. Merci. Next question, Ryan Tumulty, National Post. Line open.
Yeah, good morning, sir. The Information Commissioner is out with a fairly scathing report about how the RCMP handles access to information requests. Not only does it found that the delays are piling up at the RCMP, but the Commissioner found that the RCMP did not seem to be at all interested in addressing the issue. And moreover, even the Minister of Public Safety was at best lukewarm on solving the problem. I'm wondering what your response is to that report, and if your government is still interested in fixing the access to information system.
Canadians need to have confidence in their institutions. We need particularly to have confidence in institutions like police forces like the RCMP. One of the best ways to do that is to demonstrate transparency and accountability. We have seen in the past that there have been challenges on that, and I thank the Commissioner, the Privacy Commissioner, the Information Commissioner for bringing that forward, and we will certainly be looking at how we can ensure that Canadians have full confidence in their national police force.
Following up, Ryan.
Yeah, sir. The Commissioner made 15 recommendations specific to this issue. Will you commit your government to implementing those recommendations? We're
going to look very closely at those recommendations and move forward on the ones that will restore Canadians' confidence in our information access to information regime and the work that our institutions do to respond to it.
Merci, opérateur. Dernière question au téléphone.
Thank you, operator. Last question on the phone.
Merci. Prochaine question, Catherine Lévesque, La Presse canadienne. À vous.
La Presse canadienne, Catherine Lévesque. Hello, Mr. Trudeau. I'd like to hear you talk about another report, the one from the Parliamentary Budget Officer. Over $2 billion, we heard, could have been saved by buying equipment from Davies, rather from the ones purchased from C-SPAN. So I'd like to have your response on that. If you had to do it again, would the federal government, should the federal government have chosen a more economical option? Of course, we're always going to study reports from the PBO. We will learn better how things could have unfolded, and we will review that report. About the project for the shipyards, we know how important it is to provide for people to be able to plan ahead. C-SPAN was chosen. We were able to add a third place. We gave contracts to Davy, because we recognize the important and excellent work work that the Davy workers do, and we will continue looking for opportunities to build ships here in Canada to make sure that we have the right equipment for Canadians while ensuring that the investments made are responsible. A follow-up question. Yes, concerning Huawei. Aaron O'Toole will ask you about that today. Why does it take so much time to make a decision? Could you make a decision in the next 30 days? And maybe this is a negotiation technique to liberate both Michaels. From the outset, we have relied on the advice of our experts in national security and intelligence. We have always worked with those who are in charge of this. We have worked with and consulted our allies throughout the world before making a decision based on expert recommendations.
As we've said from the beginning, we will continue to trust our security agencies and experts when it comes to making this important decision on how to protect Canadians and our businesses in an increasingly interconnected world. We have worked with our allies, we have consulted broadly, and I can tell you that the decision we will make will be based on the recommendations of our security agencies.
Merci. On va maintenant passer avec les questions dans la salle.
Thank you. We'll now go to questions in the room.
Good morning, Mia Rabson from the Canadian Press. Last spring, when the pandemic was just starting in Canada, you had a message to Canadians that it was time to come home, that you wanted people not to be traveling internationally. As we're heading into the winter, there are a lot of snowbirds who are suggesting that they want to travel and do plan to go to the United States. What's your message to them? Is it a safe thing to do right now?
Canada's official travel advisory is that all Canadians should avoid international travel. The pandemic continues to cause significant challenges around the world, including in the southern United States, and people are safest when they stay at home in Canada. Obviously, if people do choose to go, that is their choice, but they need to make sure that they have good health insurance, good travel insurance, also that they make sure that wherever they're going, there is sufficient healthcare capacity that is not beginning to get overwhelmed if something goes wrong. But that's why, as a government, we recommend people not travel internationally while this pandemic is going on.
As a government, we recommend that Canadians do not travel abroad during this pandemic. If people choose to do it, they have to accept the risks of that. They have to have good insurance. And they must be aware that health systems around the world are being overwhelmed by this second wave. And they might have a hard time getting the healthcare services they need if the worst case scenario happens. So that's why we strongly recommend that Canadians stay home.
Next question.
Hello, Prime Minister. It's Annie Bergeron-Oliver with CTV National News. There have been calls from mayors and doctors for the federal government to step in and do more, including implementing tougher measures like a temporary lockdown. Are you afraid to take this action because of political blowback from businesses and other sectors? And also, what do you say to those businesses who are angry that they still have not received the rent subsidy because Parliament has yet to pass C9?
First of all, we have been there from the beginning for businesses and for Canadians, and we will continue to. The best way to get through this with a strong economy is to focus on protecting Canadians and slowing the spread of this virus. That is the decision we took from the very beginning as a government. That's why we made the commitment to have each other's backs, have Canadians' backs, and we will, whatever it takes and as long as it takes. The rent assistance that was passed through the House with C9 that we hope will pass through the Senate shortly will be retroactive to the beginning of October, and includes a 25% top-up for businesses in places like Montreal, Toronto, and elsewhere where public health authorities have forced a shutdown. We know that this is extremely difficult on Canadians and on businesses, but the position of the federal government from the beginning has been to make the difficult decisions by regional authorities, by provincial authorities, by local public health authorities easier, in knowing that businesses that have to close will get strong support from the federal government. That's the promise we made, and that's a promise we're keeping. Nous avons fait une promesse aux
We
Canadiens
made a
que le
promise to
gouvernement
Canadians
fédéral
that the
allait être là.
federal government
Pendant
would
cette
be
pandémie,
there during this
quoi que ce soit qui
pandemic.
se passe,
Whatever
quel
happens,
que soit le niveau de besoin, nous
whatever
allions
the
être
level
là.
of needs
Pour les familles, pour les
is, we will
travailleurs,
be there for families, for
pour les petites
workers,
entreprises, pour les
for
grosses
small
entreprises.
businesses and large
Et on l'a
businesses.
été et on va
And we have
continuer
been there
d'être là.
and we will
Le
continue to
gouvernement
be there.
fédéral
The federal government
est en train d'aller de l'avant avec
is
le projet de
currently
loi
going
C9 qui
forward
devrait
with
passer
Bill
le Sénat dans les
C9,
jours à venir
which should be
pour
passed in the
permettre
Senate
à
in the
donner
following
jusqu'à
days, which would allow
90%
up to
d'appui pour le loyer
90%
commercial pour des entreprises dans
support
des endroits
for
qui ont été
commercial
forcés
rents
de
for
fermer
businesses that
à
were
cause des
forced to
ordonnances de
close
santé publique.
because of
Nous sommes
public
là
health
pour
directives.
appuyer
We are
les
here
entreprises,
to
les
support
travailleurs, les
businesses,
familles,
workers,
les aînés, les
families,
jeunes. On est là pour aider les Canadiens
elders
à
and
passer
young
à travers
people.
parce
We're
qu'on
here to
sait que la
help
meilleure
Canadians get
façon
through this
de
because we know
protéger
that the best
l'économie
way to
et nos
protect the
entreprises,
economy and our
c'est
businesses
d'avoir sous contrôle cette pandémie,
is
de
to
réduire
keep this
les cas.
pandemic
C'est
under
ce que nous
control
allons
and
faire
reduce the number of
et c'est ce
cases.
que nous
This is
avons
what
fait.
we're going to do, and this is what we have done.
Bonjour, M. Trudeau. Philippe Vincent Foisy de Radio-Canada.
Hello,
J'ai
Mr.
une question
Trudeau
sur le
from
projet de loi sur la vie
Radio-Canada.
privée, la
I have
protection
a
de la vie
question
privée.
about the
Il n'y a pas de mécanisme en ce moment pour ceux et
There is
celles
no
qui
mechanism
sont
right
des
now for
victimes
those who
de
are
ces vols de données,
victims
qui ont
of
tout perdu,
information
qui
theft, who have
doivent
lost
vivre avec le
everything and who
stress,
have to
avec les
live with
appels,
the
la
stress
paperasse.
of
Pourquoi ne
calls
pas
and
avoir mis de
paperwork.
mécanisme dans votre projet de loi? Et que
Didn't you put a
dites-vous à ceux et
mechanism in
celles qui
this
aujourd'hui se retrouvent
bill? And
les
what do you
mains
say
vides, ne
to
pas savoir à
those
quelle
who are
porte cogner parce qu'ils se sont
empty-handed
tout fait voler de leur
because
identité?
their identities were
D'abord,
stolen?
nous
Answer,
avons
response.
énormément de préoccupations pour
We
ces gens
are
qui sont
very
victimes de
concerned
vols
about these
d'identité.
people who are
Et
victims
nous
of
avons mis des
identity
mesures en
theft.
place
We
et nous
have
allons
put measures
continuer
in
de travailler
place
pour les
to
aider
continue
pour
working to
les
help them.
ramener à une vie normale
We want to
suite à ces actes
give them
criminels
a normal
qui les
life
ont
back
attaqués.
after these criminal acts that they were a
Le
victim
projet de
of.
loi qu'on a mis de l'avant
The
aujourd'hui
bill that we put forward
vise vraiment
today
les compagnies qui ne
is
permettent
targeted
pas aux
at
Canadiens de savoir comment leurs
businesses
données
that
sont
don't
utilisées
allow,
ou de
that
garder le
don't
contrôle de leurs
inform
données.
Canadians of how
On
their
a vu
information
les
is
géants
used or
du
don't
web
give
et
them control
d'autres,
over that. There are web giants out there,
utiliser les données
and
de
we've seen them
façon
use
qui n'est tout simplement pas correcte.
information in a way that is not appropriate
les
for
intérêts
Canadians'
personnels.
confidentiality. They've used it for personal interest, and that's why we've put in place measures that are some of the most stringent in the world and very high fines, some of the highest in the world. And the idea is to make sure that the web giants and the companies that manage the confidential information of citizens are accountable, and we want citizens to be in control of what happens with their data.
Prime Minister Tonda McCharles, Toronto Star. Can you tell us more about your government's signing of some contracts last week, apparently that guarantee ultra-cold and refrigerated storage for about half, I guess 33.5 million doses of vaccines? What are those contracts, and what role do you see the military providing in vaccine delivery?
As I've said from the beginning, the federal government is doing what is necessary to keep Canadians safe and get them through it. The first part of that was obviously making sure that we sign contracts with a range of vaccine producers, potential vaccine producers around the world, to give Canadians assurance that regardless of which vaccines landed first, which companies were more successful in developing an effective vaccine than others, Canadians would have access to millions, tens of millions of doses of vaccines when they become available. That was really important. But obviously, getting those vaccines from an airport tarmac or a port to Canadians right across the country is a significant logistical challenge, one in which the government is focused on and working on ardently to be able to make sure that as vaccines arrive, they're getting out to the most vulnerable and the people who need it in a priority basis. That will involve multiple government agencies, possibly private contracts as well, may well involve the Canadian Armed Forces. We are busy establishing different logistical approaches for the range of vaccines that will be hopefully arriving in Canada in the coming months. This government remains focused on delivering for Canadians because we know that getting vaccines to Canadians is the best way of getting through what is going to be a very difficult winter for us all. Nous avons pris dès le début une approche
Response. From the outset, we have taken an approach that seeks to give access to a number of vaccines. We know that a number of companies around the world are currently working on developing vaccines, but we don't know which one will be the most efficient or that will arrive first. And that's why we've signed contracts with a number of different companies, and Canada has one of the best potential vaccine portfolios in the world. But it's not enough to just have signed these contracts for tens of millions of vaccine doses, rather. We have to bring those vaccines directly to Canadians so they can be efficient. That's why we're working on logistics now. We're working with the different government agencies, and there are partners in the private sector as well. And there's the likelihood that the Canadian Armed Forces will be involved. We'll continue to do everything that's necessary to help Canadians get through this difficult winter. But we have hope for the spring.
Prime Minister Tom Perry, CBC. Can you talk a little bit about the talks that you're having with the provinces and territories in terms of a national rollout strategy for these vaccines? And could you just clarify what role you do see the military playing, if any, in getting these vaccines out to people?
Obviously, conversations are ongoing with the provinces on a large range of subjects, particularly the hope everyone has around vaccines means that it's of tremendous interest to a lot of Canadians. We need to get through this second wave. We need to lower the number of cases and stop the rapid spread of COVID-19 because vaccines are many months away. Yes, we continue to work with the provinces and with various partners, including potentially the Canadian Armed Forces, on delivering the vaccines. But like I've said, there are many different vaccines that require different logistical supports, from extreme cold storage to simple refrigeration to potential room temperature doses as well. These are things that will require a differentiated approach, and we're working very carefully and closely with the provinces and other partners to make sure that vulnerable Canadians get these vaccines on a priority basis. But even as I know we all like to talk about the potential of vaccines in the coming months, we still have to get through the next month and the month after that before vaccines arrive, where we need to do what we can, seeing the light at the end of the tunnel coming, knowing that we have to make sure that we're getting through this difficult winter as best we can. That's the focus of this government.
Hi, Prime Minister Abigail Beeman, Global News. Do you believe that a national lockdown is inevitable? And on the question on how broad one may be, I'm wondering where you stand on the idea of closing schools.
I think those are questions that a lot of Canadians have. What are the next steps? How are we going to get this this virus under control? What's going to happen in schools? Those are questions, quite rightly, for our medical experts and for provincial authorities. As people know, the federal government's role is to be there to support the provinces in the decisions they make. We delivered over $25 billion in supports to the provinces for things like testing and contact tracing and protection for vulnerable people. We've developed an app. We've worked on delivering PPE and manufacturing PPE in Canada. We've moved forward on supports for mental health, for opioid addictions. We've moved forward with a range of investments, including getting kids back to school safely to the provinces that are all designed to be able to make sure the provinces can make the right decisions to protect their citizens. On top of that, we've given direct supports to families right across the country, to workers who've been laid off or lost hours, to small businesses, to large businesses. We've continued to move forward on everything the federal government needs to do to make sure Canadians get through this. We will continue to work with the provinces and public health authorities on what needs to be done to get this pandemic under control. But obviously, what they're looking at in the Atlantic bubble, what they're looking at in the Arctic, what they're looking at in places like Alberta or Ontario differ greatly from one region to the next. And that's why the federal government is there to support Canadians, to support the provinces, and to work with the provinces as they make the decisions on how to flatten the curve in their region.
vous entendre en français sur Noël, parce qu'il y avait dans sa question
A
Noël. Est-ce
question.
que
There was this
vous
issue of
voyez
Christmas.
des mesures plus
Do
strictes
you
fédérales,
see more
un
stringent
lockdown
federal
fédéral d'ici Noël?
restrictions
Est-ce que vous voyez que
coming into
Noël, ça va
place?
être possible en
Do you think
petite
Christmas
famille?
will be possible in small
Je
family
pense que
groups?
cette idée
Answer.
d'invoquer
I
la
think
loi
that
sur les
this
urgences
idea of
ou
bringing up the
des directives
Emergency Measures
agressives du
Act
fédéral,
or having
on
more
n'est pas rendu
stringent
là et
restrictions,
j'espère
I
qu'on se
don't
rendra
think
pas là.
we're
Je
there
pense pas
yet.
qu'on va se rendre
I
là
hope we
parce que
won't. I
ce que
don't
je
think
vois
we
des
will,
provinces,
because
c'est
what I
que
see
ils
from the
sont en train
provinces
d'agir,
is
ils
that
sont en
they
train,
are taking action.
de créer plus de restrictions pour
They
qu'on
are
puisse
putting in place more
justement,
restrictions
ralentir
so
la
that we
progression de la
can
COVID-19.
slow
On
down
sait
COVID-19's
que
progression.
Noël sera pas un
We
Noël
know
comme
that
les autres, ce
this will
sera pas
be
comme
no
Noël
ordinary
2019,
Christmas. It
mais à
won't be
quel point il y a
like
des
Christmas
restrictions, à quel point
2019.
il y
And
a
to
des
what
limites
extent there
sur
will
ce que
be
les gens
restrictions or limits on what
peuvent
people
faire
can do,
dépendra de la
well,
région
all of
dans
that will
laquelle ils se
depend
trouvent et
on the region
dépendra
they're in,
aussi
and it will also
de ce qu'on
depend
arrive à faire
on
tous
what we
ensemble
manage to
dans
do
les semaines à
together in
venir.
the
Il faut
coming weeks.
agir
We
maintenant.
have to act
Dr
now.
Tam a souligné
Dr. Tam
qu'on pourrait faire
highlighted
face à 10 000 nouveaux cas
that
par
we might
jour
have
au début du mois de
10,000
décembre.
new cases per
C'est pas la
day in
direction dans
December.
laquelle on
That
voudrait
is
aller
not the direction
si
we
on
want to
espère
head
avoir
towards.
un
If
Noël
we hope to
qui a
have
des éléments
a
qui ressemblent à un
Christmas
Noël
that
habituel. Mais
lets
l'important,
us
c'est
at
que les
least
gens fassent
have
leur
a,
part
a
maintenant
sort of
pour
normal
pouvoir
Christmas.
essayer
But
d'avoir les
there's
meilleures
things we can
circonstances
do
possibles.
right now to help us have the best circumstances
I
possible.
think as we look towards the coming months, a lot of people are wondering what Christmas is going to look like. Obviously, the holidays will be different this year than in years past. There's no question about that. But how different and how much we're able to do will depend on a few things. What region of the country you're in, what people are able to do between now and the holidays in order to flatten the curve, to reduce the number of cases. We will continue to work with the provinces in a very collaborative way. The provinces all obviously want the same thing, to save as many lives as possible, to prevent our health systems from getting overwhelmed. And that's why we're going to continue to work with them. I don't think it is going to be necessary, certainly it's not desirable, to invoke the Federal Emergencies Act. I think we can work closely with the provinces on making sure we're all doing the right things without having to go heavy-handed from the federal government.
Thank you, Prime Minister. This is all the time you have with us today. C'est tout le temps que vous avez avec nous aujourd'hui.
That's all the time you have with us today.
Thank you. So we'll now move on to the doctors. We'll go to the phone for one question before continuing in the room. Operator, over to you.
Thank you. Merci. Next question, Dylan Robertson, the Winnipeg Free Press. Line open.
Good morning, Dr. Tam. I had a question about assessing contact tracing needs. Do we have any benchmarks for provinces to assess whether they have enough contact tracers? Who sets those metrics? And also, why are Canadians getting contact tracing calls more than a week after someone tests positive?
So, contact tracing is in the provincial jurisdiction, and it's carried out by local medical officers or their teams, and being supported by the federal government as requested. So we have contact tracers that could potentially help, and the provinces would have to send in a request to supplement their capacities. What we're seeing, though, I think, which has resulted in more restrictive public health measures, is that a number of jurisdictions are unable to do that rapid contact tracing, given that with the number of cases per day and how many contacts they were having, this began to be overwhelming the actual public health system ability to do that. So I think what you are commenting on is that phenomenon, which is why restrictive measures were put in place in order to get the cases under control. And honestly, during that time, capacities have to be assured, prepared, and built so that if you were to relax measures, that the capacity is there to do the testing, detecting, and isolation. Many jurisdictions had a benchmark, which is to reach their contacts within like a 2-day period. But that is not something that is attainable with so many contacts right now. So I think our message, broadly speaking, has been to really, for both public health, governments, society, and individuals, to try and reduce those contacts and limit them to the essential as much as possible.
Thank you, Dylan. Follow-up?
Thank you, Doctor. And I just wanted to ask about the impact of postponed surgeries. The Globe and Mail reported today on kids that will have lifelong problems after missing their window for surgery and outgrowing the time that they needed help. I'm just wondering if SAC has done any planning exercise or issued any guidance to mitigate the impact of postponed surgeries or how to prioritize things. And if you could also explain if that's for kids or just general delayed surgeries.
I think, again, the health system is in the purview of the provinces and territories, but I think the number of cases have increased to the extent that a number of hospitals and a number of municipalities are now scaling back on elective surgeries, so the non-urgent medical procedures or admissions, which clearly is an extremely troubling indicator, and which is, again, why we have to get the number of cases under control, because it can have significant longer-term impacts. But it is, I think, within the realms of the discussion, frequent discussion, I think, with the deputy ministers and the ministers of health in terms of the health system capacity piece. And from a public health perspective, we've been really given the huge responsibility to get transmission down so that it doesn't impact the healthcare system. So I think that's the sort of collective challenge that we have right now.
Thank you, Dr. Ham. We'll now turn to the room. Philippe?
Oui, bonjour, Philippe Vincent Foisy de Radio-Canada.
Question
Monsieur
from Radio-Canada. Dr.
On
Njoo.
a une étude italienne sortie
There's an
aujourd'hui qui
Italian
dit
study that
que
came out today
eh bien, le coronavirus,
saying
le
that
SRAS-COVID-2, se serait
the
répandu en Chine plus tôt qu'on le pense.
coronavirus
Dès
was spread in
octobre,
China more
on
than we
aurait eu des
thought,
cas.
as of
Selon
October,
une
as
nouvelle
early
étude
as October,
italienne, est-ce
according
que
to a new
vous êtes au courant
Italian
de cette
study.
étude-là?
Are you
Est-ce que
aware
c'est
of this study?
possible que
Is it possible
finalement la COVID se soit promenée dans la
that
population silencieusement des
COVID
mois avant
was
le
silently
début de cette pandémie?
spreading throughout since the beginning of this pandemic?
Merci pour la question. Moi, je ne suis pas au
Thank you
courant
for the
avec
answer.
les
Thank you
détails de
for
cette
the
étude.
question. I'm not aware of the details of that
C'est
study.
sûr qu'il y a toujours
Now,
les
certainly,
études, les données
there are
probantes qui
always
continuent à évoluer avec le
studies
temps, mais nous autres, je pense,
facts
on est
that evolve over
préoccupés
time,
avec qu'est-ce qui
and
se passe
we're concerned
actuellement.
with what's
Les
happening right
théories
now.
avec qu'est-ce qui se passait, c'est intéressant, mais
Now, other
ça,
things
ce n'est pas,
that have happened
comment dire,
are very, it's
important
interesting
pour,
to know those things,
ce qu'il faut faire maintenant.
but they're not
C'est
always
sûr
pertinent to what
qu'on a-
needs to
on a
be done
souligné le
now.
point plusieurs fois.
We've highlighted
Il
this a
faut,
number of times.
Toujours, tout le monde
Everybody
continue à pratiquer les
has
bonnes
to
mesures de
continue
santé publique
to
éprouvées.
uphold
C'est
public
pas tannant.
health
Je comprends,
measures.
tout
And
le monde est
it's
fatigué,
tiresome.
mais,
I know everyone's tired.
c'est sûr, les 3-4 principes, la distanciation physique,
These are
le
3 or
port
4
du
things we have to
masque,
do. Wearing a mask,
nettoyage,
social distancing,
les surfaces,
washing
et aussi,
surfaces.
je ne sais pas quoi d'autre dire. Le
And I
lavage
don't
des
know
mains
what
aussi,
else to
c'est-
say.
on continue de
Washing
souligner le
hands.
point.
We keep highlighting the importance of those.
Et ce que je peux dire, c'est
What I
vraiment
can
ça
say
prend l'effort de tout le monde.
is that it
C'est
takes
sûr que c'est pas
everybody
seulement les
working
gouvernements, aussi
together.
des autorités de santé publique.
It's
Je
not
pense
just
que
the
peut-être
government
ajouter
and
à ce que
public
Dr. Tam
health
dit,
authorities. I can
maintenant,
add
je
to what
pense que
Dr. Tam
les
said.
systèmes de soins de
Now,
santé, aussi les
the
systèmes de
healthcare
santé publique sont
systems
jusqu'au
and the
point d'être
public health
débordés.
systems are just on
Je
the
pense
verge of
qu'au
being
printemps,
overwhelmed.
le nombre de
In the
contacts
spring,
avec une cas
the
confirmée,
number
c'était
of contacts with a
environ
confirmed
5-6
case
parce que
was
tout le
about
monde
5 or 6
restait chez
because
eux.
everybody was staying
Maintenant, c'est
home.
comme,
Now,
trentaine, quarantaine, cinquantaine
we're up
de
to
contacts
30 or
et c'est sûr que
50
les principes de
contacts.
suivi de
And
contacts
the
de
principle
traçage restent le
of
même
contact
maintenant aujourd'hui
tracing is the
qu'avant.
same
Mais c'est
today
plus
as it was
difficile
before, but
pour
it's more
les travailleurs
difficult
sur le
for
terrain de
workers
faire le bon
on
suivi
the
des contacts
ground
parce
to
que
do
il y
proper
a
contact
beaucoup
tracing
trop de contacts
because there are too many
à
contacts
faire le
happening
traçage. Donc,
between
je pense que
people
c'est
to do
vraiment
the
important
tracing. So
aujourd'hui
it's really
que tout le
important
monde
that as of today,
réfléchit ce qu'il
everybody
fait actuellement. Il faut vraiment limiter le
think
nombre de
about this
contacts
and
et
limit the
on
number
espère
of
qu'on
contacts
va
you
voir
have with
les effets,
others.
de
We
bons
hope
effets
that
dans
we'll
quelques
see
semaines.
the positive effects of this in a few weeks. Follow-up
Mais je
question?
vous entends, on parle beaucoup des
I hear what
écoles,
you're
est-ce qu'il faut
saying.
les
We talk
fermer
a
avant
lot about
Noël?
schools
Est-ce
and
que
that
les
they should be
systèmes de
closed
santé
before
sont
Christmas.
adéquats? Est-ce que les
The
décisions qui
health
sont
system
prises, notamment sur
sufficient?
le
Are the
chirurgie, sont adéquates?
decisions
On répétait,
being
c'est les
made
provinces, c'est les
properly?
provinces,
For
c'est les
example, the
provinces.
ones dealing with
Une question pour vous
surgery.
sur le
We say that
fédéral.
that all has to do
Là,
with provinces.
aujourd'hui, à part
But right
répéter de
now,
se laver les
today,
mains, de faire
rather than
attention,
repeating the
d'arrêter de voir des
importance of
gens,
washing hands
qu'est-ce
and
que le
stop seeing people,
gouvernement fédéral,
what
qu'est-ce que l'Agence de santé publique fédérale peut faire de plus?
what can the federal
Qu'est-ce que
government or
vous
the Public
pourriez
Health Agency of
faire
Canada
de
do
plus que
more
vous ne faites pas, qui serait
more
utile
than you're doing
pour
right now
aplatir
that
la
would
courbe,
be
à part
useful
répéter?
for flattening the curve rather than
Je
repeating
pense qu'il y a plusieurs
what's
aspects.
already
Merci pour
been
la
said.
question. Je pense que,
Response.
premièrement, comme le
Thank you for
Premier
the
ministre a
question.
souligné, le
As the Prime
gouvernement
Minister
fédéral est toujours
highlighted,
prêt
the
à
federal
supporter les
government is
provinces et
always
territoires. Et
willing
nous
to
autres, Dr.
support
Tam et moi, si on
provinces
parle de
and
la
territories.
perspective
And
de
Dr.
santé
Tam
publique,
and
on
I
a toutes
always
sortes
talk
de
about things
ressources.
from
On a
the
des
public health
épidémiologistes,
perspective.
on a aussi
We talk with
des autres ressources
immunologists.
humaines. On a
We have
l'expertise
expertise
dans le domaine des laboratoires pour donner
in
l'appui aux provinces et territoires au
laboratories
fur et à
to
mesure.
help
Mais
support
à
the
part de
provinces
ça, je
and
pense que
territories as things
c'est
evolve.
très
But
important
apart from
aussi
that, I
de
think it's
toujours
also
échanger
very
l'information, les
important
bonnes
to
pratiques
share
avec nos
information
homologues
on
des
best
provinces et
practices
territoires.
with the
C'est
provinces and
intéressant,
territories
j'ai remarqué
between
qu'aujourd'hui,
colleagues.
tout de suite après le point de presse, Dr. Tam et
Well,
moi,
right after
on va
this
assister à notre 100e
press
apparemment
briefing, we are
téléconférence
going
de
to
la
attend
comité
our
consultatif spécial
100th
depuis le début. La
meeting
première téléconférence, je pense, a eu lieu
on
le
this.
28 janvier.
I
Et
think
on
the first
continue
one was
de
January
discuter
28th, and
les
so we
enjeux
keep
actuels avec nos
discussing
homologues.
current
C'est
issues
sûr qu'il y a des
with our
différences entre
peers.
les provinces et territoires, les
With our
réalités sur
counterparts,
le
of course,
terrain.
things are
Mais
different in each
les grands
province and
principes,
territory, but the
c'est
main
quoi la science,
principles
c'est quoi
are around
les prochaines
science.
étapes
What are
peut-être
the
à
next
mettre en vigueur.
steps that need to be
Toujours dans le contexte
implemented?
des provinces et territoires, je pense que ça,
Always
c'est
in the
un
context of
rôle
the
important pour le
provinces
gouvernement
and
fédéral.
territories. I think that's an important role for
Merci,
the federal
Dr.
government.
Newton-Tonda.
Thank you,
Good
Dr.
morning.
Njoo.
Dr. Tam, can you talk to me about what role the military can play, not only in vaccine delivery, but in this, what you call extremely troubling time where we're in a bad second wave? Do you see, is there planning underway for the military to provide, for example, field hospital capacity that would relieve some of the pressures you've talked about where people are canceling surgeries and whatnot?
So the pandemic response is a multi-departmental response of which the Canadian Armed Forces, the military, has been an integral partner. I think it is really important that we do everything to not get to the point where the military has to be sort of redeploy, for example, to long-term care facilities. But of course, people can get ready to do that. We've engaged the Canadian Red Cross for the purposes of building up capacities that are not the more civilian focus, so that you don't get there, because that's not what the military was created for, is to backstop all long-term care facilities. So we have to do everything to not have them get there. But they are involved in they are incredible logisticians and have expertise in so many aspects of the logistic side of the response. And so I think with the vaccine distribution, that kind of expertise is really paramount. And then we've been obviously working with that kind of expertise for some time in developing the logistics plans and the implementation plans. And particularly at the beginning of any vaccine implementation with ultra cold supply sort of chains and that type of thing is where they're extremely valuable. Obviously, there may be other needs through which the provinces will have to go through the channels, but a lot of it might be to deal with logistics, transportation, and those aspects. But it's really, really important that we don't get to a point where you're now spilling over into additional hospital wings or something like that. Yes, we do have those kind of capacities, but it's not limitless, and we should not get there. That is not a good place to be. So, they, there's different parts of the military are, incredible partners right now.
Thank you.
So I understand that answer, and correct me if I'm wrong. I understand you to say then that the Red Cross is looking at civilian capacity to augment hospitals, but there is no plan for the military to stand up field hospitals and whatnot. If I'm wrong on that, you can correct me. But my second question is more to around that ultra cold storage and the needs, the ultra cold storage chain you need. I understand from looking at things that it's only the one vaccine that requires that. The others require either the -20 or the 2 to 8 degree range, right? Last night, the minister said that 33.5 million doses, you've made provisions to contract for the storage of that much vaccine. Can you tell me more about that? Is all of that ultra cold? Is some of it? Is none of it? Who's got the contract? That's the kind of thing I'm looking for.
I'm not the sort of in that field of sort of experience right now. That implementation teams on public PSBC. Obviously, we can sort of get back to. But right now, what is happening is that all provinces are working on their specific sites for delivering, where they want the vaccine to be deployed to. And they will have those plans, which then informs the exact support and distribution. Right now, we're just getting those things ready so that they can be situated in the area where the ultra cold vaccine will be deployed. And so, that's the bottom line. And I think, as in all aspects of the pandemic vaccine response, there's contingencies built in, extra capacities, so that that can be accommodated, because we do not know the how many vaccines are going to be successful. We now know of 2 with some promising preliminary announcements. We haven't seen the data, but at least it sounds good. We haven't heard from the other vaccines as yet. So you got to prepare for all eventualities that maybe all 7 vaccines would be deployed over time. And so, but it does become easier over time when the fridge sort of stable vaccines come into play, where one expects that the need for federal support will gradually be, more in the left to the province and territories. But we are really important at the initial implementation stage with these more challenging vaccine logistics. So, but I do know that, yes, absolutely sufficient freezers are being purchased. Some are already, we've mapped out the ones that are already in Canada and the additional ones that might be needed.
Military,
Thank you.
That right?
Thank you,
Sorry?
Dr.
You didn't correct me on the military thing.
So, field hospitals, I think, again, you don't want to get there, and they maybe need to transfer people from one site to another site. There's different plans. But if there are additional hospital requirements, it can be staffed in different ways. And I'm sure that if there was a request to the military, it can be considered, but that's not where you want to go.
Dr. Maybe just add to Dr. Tam's answer about sort of the vaccine and sort of the number of doses that I think our minister referred to in terms of total number that we have, advanced purchase agreements. I think it's a bit of a moving target. But one thing I think we can say is that the number of doses in terms of the initial shipment won't be all at once. We recognize that, right? It'll come, in different sort of batches. And I think one of the things that we're planning for as well is that, with that first shipment, whenever it does come, hopefully sometime early in the new year, that we have the plan laid out with the provinces and territories, the logistics in terms of who could or should receive that first sort of a shipment of vaccines, whatever those successful vaccines are. And I think, as you know, we've had the NACI statement come out in terms of the priority groups. So there's lots of discussions and work going on behind the scenes. And certainly, I think what we're looking towards is that as hopefully these two vaccines get approved, because we still have to obviously look at the clinical data, the clinical trials, make sure that our regulatory colleagues are comfortable and approve them. And the other vaccines, hopefully, if they also get approved and get rolled out later in the year, certainly we're looking at hopefully covering the vast majority of the Canadian population, quote, by the end of next year. But like I say, this is something that's happening in real time, and certainly there will be adjustments made as we move along. Thanks.
Thank you, Dr. Njoo. Mia?
Good afternoon, Mia Rabson from the Canadian Press. Dr. Tam, usually by this time, there's hundreds of people that have been diagnosed with influenza. And this year, the latest report says we've had 17, which seems like a drastic drop. Can you talk a little bit about how this is helping the hospitals, which already seem overwhelmed, and what we can expect going forward? Is the flu season really going to be non-existent now? Do we know that yet?
I don't like to forecast too early, but obviously, right now, the influenza activity this would be the sort of beginning of our usual flu season, and we have an extraordinarily low number of influenza cases, despite testing at a higher rate than what we normally do. So that's a pretty good sign that the hygienic and public health measures we've implemented for COVID-19 is obviously having an impact. Also, as everybody's heard, there's a phenomenal uptake in the influenza vaccination programs. So that's also going to add another layer of protection, which is absolutely essential right now because you cannot afford to have influenza cases coming in and taking up emergency room and hospital bed capacity. So that's definitely, and thank everybody who worked on influenza, would have had I think, a very important impact on reducing healthcare system needs. So I think definitely looking good at this point.
And I'm also wondering, the World Junior Hockey Championships, I believe, are scheduled for Alberta later this year. I'm just wondering if you can talk about the clearances that have been given, what kind of clearances, if they've been given a clearance, and what the plan is for that.
Thank you for the question. It's Dr. Njoo. I will say that myself and others, we've been engaged in discussions, ongoing discussions, with Hockey Canada and all the relevant partners, including as well public health officials from the province of Alberta. I think the proposals and what's been put sort of forward to us at the present time, it looks very promising, looks very good. Certainly what we've seen is that the model they're going to be intending to use is similar to the bubble concept that's been used successfully, for the NHL playoffs and the NBA as well. So that certainly is a good start. And certainly the lessons learned, the experience that obviously Alberta had, because they were one of the hub cities, they had one of the hub cities for the NHL playoffs that will certainly serve them in good stead. So at this point, obviously, we're still looking at the proposals, but I can say that from a technical public health point of view, it looks good. The only thing that I would add to that, though, and everyone involved is I think, appreciative of the fact is that between now and December, it's supposed to happen during the holiday season. Lots can happen, right? And people recognize that there's still that sort of unknown factor in terms of what the situation will be like in Canada at that point in time. Thanks.
Thanks, Dr. Njoo. Annie?
Hi there, it's Annie with CTV National News. My question is for both of you. Back in March, you projected that anywhere from 11,000 to 22,000 people would die of COVID-19 over the entire epidemic. We are just about 9 months into this, and already more than 11,000 Canadians have died of COVID-19. What is behind this massive increase in the death projections? It's far higher than initially projected just 9 months ago.
Well, I think in terms of scenarios, there were, if people remember, the sort of green curves and different types of attack rates. So there are different projections based on different types of attack rates in Canada. So obviously, if we keep to the low end, we will see less serious impacts. So those are different ranges of predictions. So I'm just trying to recall which session you were referring to. But obviously, in the initial wave, there was a massive impact on our long-term care facilities, which really tragically resulted in a, over 80% or thereabouts of the deaths at the time. So, which is why in this resurgence, we must do everything to reduce that impact. And I think at the beginning of this resurgence, we said, it's in younger adults, but it's going to spill into other high-risk groups, which is what we're seeing right now. This is the time to really reduce the transmission and make sure long-term care have everything they need to protect our most vulnerable citizens. So we're monitoring the deaths very carefully. Right now, they're increasing quite steadily, but they are a lagging indicator. So we've now seen a number of long-term care outbreaks. Some of them at the beginning were quite small. Now you're getting larger ones, which means in a few weeks' time or in the coming days, we might sadly see more deaths. So protecting the most vulnerable is the key to keeping the deaths low. So what that's telling, whenever the projections are beyond the bounds of the confidence interval, it's telling me that it's a signal that we've deviated from that path and that we need to double down right now on our measures.
So that initial projection of 11,000 to 22,000 was with strong epidemic public health controls. So does that indicate to you that we need more stronger measures, that we didn't hit that green curve that everyone was hoping for initially? And do you think that right now, as you were mentioning, because deaths are rising, that lockdowns in specific regions would be useful? It seems like the constant messaging of wash your hands, wear a mask, stay 6 feet apart isn't working in some places.
Well, reducing the amount of contact, I think about to have another modeling session on Friday, if all is going as planned. I'm not saying that we've gone off the green curve. There's ranges of predictions for that. And in fact, serologic analysis will be repeated, but suggests that the amount of infection in our community was actually quite low. So we were quite successful in that first wave, and we can be successful again if we rapidly get the resurgence under control. So we've done it the first time. We've got even more tools now. We should be able to do this. And protecting the vulnerable settings is really key. So I think, as I said today, rapid suppression of the current curve is important. Individual actions are important, but it's not insufficient, which is why, society, governments are enacting measures to reduce gathering size and limit certain settings right now. So when transmission is high, the key is to reduce contacts through these means. When the numbers get lower, you have to focus on stopping transmission in what we call super spreading sort of environments, and really get in there and deal with every spark. Right now, you can't deal with every spark. There's too much transmission, so you've got to get the transmission down first. During this time, it's not a matter of looking at the number of cases going down and then releasing those measures. During this time is the time to prepare so that you don't get another similar re-escalation. So making sure the testing, contact tracing, isolation, protecting those vulnerable settings have to be in place. So you can't just track those numbers as indicators. You got to track the health system and public health system capacity. One of the most concerning elements, I think, going into the winter is that the colder weather driving people indoors. But the other elements most concerning is the exhaustion of the health human resource, which is why we all have to do everything that we can so that that system can be preserved.
Yeah, and Dr. Njoo, maybe I'll just add to what Dr. Tam said. It's interesting when you mentioned about, the modeling projections. I think our first modeling presentation was back in April. And so I think at that time, to be honest, this may be a personal reflection. We're looking at from a very technical point of view, what needs to be done, the attack rate and, projections and so on and so forth. one of the things I've certainly learned is that maybe one thing we didn't take into account, and it's something we're learning about, is sort of the human behavioral aspect and the fact we're all suffering from COVID fatigue. You know, we've been at this for many months. And so things which made sense and everyone bought into, you know, wearing a face mask, a social, you know, physical distancing, et cetera, back in April, May, we started letting go in the summer. Now we're having that second wave, and it's tough. You know, people get it. People understand that we're going to go indoors, and there's a higher risk, you know, in terms of closed settings of being exposed. But how do we get people to understand and appreciate that the situation now is just as severe, if not maybe even worse, compared to what we endured in the springtime? So that to me is, I think, a big learning in terms of the social and behavioral aspect of this. Other than that, as Dr. Tam mentioned, I would say that, you know, the lockdown aspect is certainly something that there's a certain appeal to it, but certainly I think we recognize that there are other severe consequences, both social, economic, and so on. And so that has to be taken into account rather than just quote, you know, what are the public health effects of a reduction in transmission because of lockdowns. The other part also is, as we've mentioned several times, is that it's not going to be sort of governments alone or public health. It really is up to each and every one of us as Canadians to understand, recognize, and as they say, do our part to limit our contacts and reduce transmission. And then the other aspect that's certainly within public health that we're focused on is ensuring to the best extent we can support provinces and territories is in what we call sort of, you know, the testing, you know, tracing and isolation. You know, as we mentioned earlier today, that's still the cornerstone in terms of, at least from a public health perspective, controlling transmission. And unfortunately, in some jurisdictions, they're getting overwhelmed, a bit overloaded in terms of the number of contacts that to follow up and so on. So that's something I think that hopefully with all of these things put together, we'll get a better sort of handle on and be able to move forward on that. Thank you.
Thank you, Dr. Njoo. Dr. Tim, it is 1:45 now, so if you do need to depart for your meeting, we'll take the last two questions with Dr. Njoo. Tom, over to you.
Hi. Just wondering, the Prime Minister was talking in his opening remarks about Pfizer and Moderna submitting their vaccines for approval by Health Canada. I'm just trying to find out what information you've seen so far from the companies and typically what more you would need to see before you approve these vaccines.
It's Dr. Njoo, I can take that question. It wouldn't be ourselves. As I said, certainly the data and the information that will be submitted by the companies or has been submitted by the companies would go to our colleagues who are obviously the experts in terms of the regulatory system here in Canada. I think certainly what we've seen from the press releases is a very high-level preliminary stuff. Oh, yes, 90% effectiveness. But when you get into the details, that's what the regulators will be looking for, you know. Looking at the data very sort of stratified by age, you know, which of the people enrolled in the study, who, you know, who became infected, who didn't by age group, what were the types of symptoms, were they severe, et cetera, and so on. Looking also at, you know, adverse events, looking at the diversity, because, you know, depending on sort of the vaccine and the populations, we do recognize that there are some genetic differences as well among different types of populations. So all of that very detailed stratified analysis in terms of the data that would be submitted is what the regulator is going to be looking for in terms of finally, I think, making a determination and at the end of the day, ensuring that the vaccines are both sort of, you know, safe as well as effective for Canadians.
Did I hear you say, Dr. Njoo, that you were hoping to cover the majority of the Canadian population by the end of next year in terms of getting them vaccinated by then? Is that the time frame you're looking at?
Well, that's certainly, I think, the optimistic outlook because, you know, with the first two vaccines, we actually in Canada, we have agreements for 7 vaccine candidates. The furthest along the pipeline are the two, the Pfizer and Moderna product, because they're finishing off what we call the phase 3 trials. And so that information we submit in terms of a sort of a rolling submission. And if all goes well and the data looks good and our regulators approve the vaccines, then you know, and we anticipate receiving the doses sometime, as they say, in the first quarter of next year. So hopefully, you know, January, February, and we would start to vaccinate. I would think, obviously, we won't get all the vaccine at the same time. And so we've been looking at sort of who are the priority populations. And that's certainly, I think, a matter of public record with our NACI recommendation and so on. However, the other vaccine candidates, which in some ways would be easier from a logistical point of view to vaccinate the Canadian population because they are more traditional, at least in terms of the cold chain between, being kept between 2 and 8 degrees centigrade. They're also in various stages. I think, for example, the Canadian-based company Medicago, I think they're finishing off phase 1 or they're about to enter phase 2 and so on. And so if all goes well, I think optimistically we'll have a suite of vaccines available. And if we get delivery of those vaccines, certainly I can anticipate that by, as the year goes on, that more and more Canadians, as these vaccines become available and get shipped out, will be able to be vaccinated and have a large part of the population covered by the end of next year. Oui, actuellement, on
Question
a
inaudible
reçu
to the interpreter. Response.
des données des
Yes,
deux vaccins
we've received
candidats prometteurs de Pfizer et Moderna.
the last
Et
information about
si
the
tout va bien
promising
avec
vaccines from Moderna and Pfizer, and if everything goes well, if the validation occurs with our regulators, we hope to receive the vaccines in January or February. But of course, we're not going to receive all the doses at the same time. And so we're going to have sequencing in place for priority vaccination. And we'll have to look at vulnerable populations in the healthcare system as well. So there are a number of companies, other vaccines, even Medicago, based in Quebec, while they are maybe not as advanced. They're doing phase 1 trials. But if all goes well with the other vaccines and the approbation process, we could have a choice of different vaccines, and we hope to vaccinate a large proportion of the Canadian population by the end of next year.
Dr. Njoo will take the final question from Abigail.
Hi, Abigail Beeman, Global News. Dr. Njoo, I'm wondering from your perspective, do you think another national lockdown is inevitable?
It's interesting what the question in terms of what we mean by national lockdown. I think that Canada's a big country, and even now I would say that certain parts of the country, I think the best example is the Atlantic provinces, the Atlantic bubble. They're doing well. Hopefully they stay that way in terms of the measures they put in place. And so I can't foresee, quote, a lockdown being applied to the Atlantic provinces. As well as in the north, up to now, unfortunately, with what's happening, none of it's a different story. But with the Yukon and Northwest Territories, they've been essentially keeping COVID-19 sort of a well controlled with a sort of limited number of cases. And so I think that what they're doing is fine, and they should continue in that vein. In terms of lockdowns, my perspective is that it's best done and managed, quote, as they say, at a, quote, local or provincial level. For example, in the case of Nunavut, based on the recent sort of explosion of cases, if I can call it, it's certainly very concerning. And based on the infrastructure, some of the communities have, overcrowded housing situations and so on. Certainly, I think it was a decision well made by the Chief Medical Officer of Health there to put sort of restrictions on lockdown, sort of limiting travel between the communities to really try and put a clamp down for the next 2 weeks. That situation, Nunavut, is certainly different, I would say, compared to, let's say, a province like British Columbia or even Ontario and Quebec. And even in a province like Quebec and Ontario, they have different situations, I would say, in the urban areas compared to some of the rural areas. And so I think at the end of the day, it really comes down, as we've always said, to sort of the local circumstance. I think local officials, based on their best understanding of the data, the epidemiology, the kind of drivers that are contributing to community transmission. Maybe in one jurisdiction, it's more, let's say, private parties. Maybe in another jurisdiction, it's more focused on what's happening in some commercial establishments. And so I think at this point, we're certainly having very good conversations, discussions with our counterparts in the provinces and territories, and we certainly see that they would continue in terms of what they see as best for their specific jurisdictions. Thanks.
And I hear what you're saying in terms of it being a local decision. I'm still wondering if you have a general view on closing schools. And when you said yourself that, it's hard to know what you mean by the definition of a national lockdown. In general, do you think it's a good idea, if warranted, to close schools?
Okay, I have a personal view in terms of schools. I would say that first of all, I think I've mentioned several times that what's happening in schools is certainly a reflection of what's happening in the community around. They're not sort of working in isolation, and so if there's a lot of community transmission, then certainly it's anticipated that you would get a higher risk of having cases pop up in schools, and I think that we've seen that's been the case. I think to date, for the most part, based on our discussions and the data we've seen from the provinces and territories, there have been cases identified in schools and some, quote, smaller school outbreaks, but certainly we haven't seen to date large-scale school outbreaks in which is, ongoing, continuing transmission that also, quote, spills out to a great extent in the larger community. And so I think the reason schools were open in the first place, and I think why it's so important to have them stay open, is that we know that for the well-being of children, and it goes beyond just sort of the physical, but also the social and mental well-being, that it's important for kids to go back to school. We also know that it's important for parents and for society at large. Many parents have to work, and certainly what are you going to do with the kids if they're not in school and you have a job that requires you to be out of the home? So for lots of reasons, I think it's important to do the best we can to maintain our schools open, and I think that's what's been done in large part in the provinces and territories. And so I would say that there are lots of other things I would probably look at first in terms of what we could do in various types of restrictions or limitations of activities. But certainly, from my perspective anyway, I would say that the schools are certainly be very, very low on the list, and certainly a high priority to keep open as much as it's feasible and possible.
Thank you, Dr. Njoo. That concludes today's press conference. Merci.